Hello everyone, and welcome to this presentation on physical activity for elderly women. My name is Mupundu. In this presentation, we'll be going over the health benefits of physical activity, the health drawbacks of physical inactivity, some barriers that may be encountered when attempting to involve physical activity as part of a lifestyle, and ways to overcome these barriers. Let's get started. Some of the problems of physical inactivity include poor glycemic control or poor blood sugar control, as well as lethargy or tiredness, chronic disease prevalence or the worsening of chronic diseases such as hypertension or high blood pressure, depression, and heart disease, lower urinary tract symptoms such as an overactive bladder or urinary incontinence from any stress applied, increased depression and other mental illnesses such as anxiety or poor stress management, higher rates of nursing home admissions from bone fractures because physical activity tends to strengthen the bones that normally weaken from aging. Without this physical activity, bones are more likely to fracture, which leads to hospital admissions and higher nursing home admissions due to the need for rehab. Increased healthcare costs from getting sicker and from these bone fractures previously mentioned, as well as a decreased quality of life from symptoms like depression. In order to assess the learning needs of the audience on physical activity, brief questionnaires with about 5 to 10 questions will be created, and they will focus on what physical activity, if any, is done, when and how often, who it is done with, any barriers experienced, and ways to overcome these barriers. One-on-one conversation will also go over these topics, but this is a great tool because it will allow for the audience to further expand on any questions or barriers that they may have. A group question and answer session would also be used where a panel of professionals would talk about physical activity and the importance of it, and the audience could come back with any questions that they have on some barriers they may be experiencing that they're having trouble addressing. Finally, a discussion with the activities coordinator at the Wellness Center will be done in order to determine if any physical activity classes are held, what the numbers look like for attendance, and ways to increase these attendance numbers. Using Pender's health promotion model in this presentation, it'll be important to identify personally valued benefits and emotions from physical activity, such as staying in great physical shape and having improved stress reduction. Identifying barriers and solutions, such as being unable to travel to the wellness center for exercise classes and using an exercise DVD at home to combat this. Developing competence in your personal exercise regimen, or mastery if you want to call it that, in knowing what you do on a daily basis or an every other day basis. Identifying resources and support systems in the community, such as this wellness center and classes on improved physical activity, as well as creating personal incentives like watching an extra 30 minutes of TV at night before bed or soaking yourself in a bubble bath, which is also great for soothing sore muscles after physical activity. This health education plan has a goal of 80% of the Wellness Center participants engaging in physical activity for 30 minutes 3 days a week. A possible outcome would be that the clients will be able to talk about the 3 health risks of physical inactivity. They'll be able to explain the 3 benefits of physical activity, and they'll be able to talk about 3 ways to overcome any barriers that may be experienced in trying to incorporate physical activity into their lifestyles. It is important to note that preferred exercise should be performed for increased commitments to an exercise regimen, such as walking, dancing, or aerobics. There are several research articles that attest to the importance of physical activity. I will state 3 of the findings here. One article states that increased physical activity improves lower urinary tract symptoms, such as an overactive bladder and stress incontinence. Another article finds that physical activity promotes improved muscle strength and quality of life. And the final article states that physical activity can improve mental health and depression. One of the findings is that physical inactivity can lead to poor glycemic or blood sugar control, as well as an increased feeling of lethargy or tiredness. The final article states that there are several barriers to physical activity from chronic health conditions, such as chronic pain, and there are ways to overcome these barriers that should be employed. In order to evaluate the effectiveness of this health promotion presentation, a follow-up questionnaire will be provided to the audience. It will allow for the rating of how adequate and specific this teaching was. It'll include a scale to rate personal commitment to increase physical activity. It will identify any anticipated barriers or expected barriers that the audience might think they will encounter and ways to solve them, as well as it will provide a section for feedback on how the presentation can be improved. According to the United Nations, physical activity will promote well-being and increase life expectancy. To go over some of the important points from this presentation, physical inactivity can cause or worsen chronic health conditions. Physical activities can be different and should be enjoyed by the participant. They should be performed for 30 minutes, 3 days a week. Personal commitment to physical activity should be established. Barriers will be faced but can be overcome. Participants are encouraged to find a peer or family member to exercise with for accountability or responsibility. And a questionnaire is going to be provided after this presentation. These are the references used to provide this information. I hope this presentation was informative and well received. Thank you for your time.